Hello, my name is Dr. Eric Lane. I have spent the last 17 years treating and educating auto accident victims. Every day, thousands of Americans are involved in auto accidents, and they aren't lucky enough to have the information I'm about to give you. As a result, they either receive inappropriate care for their injuries, or they never get their injury diagnosed properly, and they often settle their cases too soon. Most insurance companies and adjusters know all about the kind of injuries people like you and me experience in auto accidents. They know sometimes you don't feel injured right away, and that's why they try to settle as quickly as possible, while your medical bills are low or non-existent. They'd rather see you in pain after you settle, with you picking up the bill later on. This can happen even if it's your own insurance company that you're dealing with. Make no mistake, insurance is a business like any other. The less insurance companies spend on appropriate care, the more money they make. They're shareholders. Even if you were involved in a minor fender bender, studies have been proven to show that you may be suffering from severe injury that isn't easily noticeable. You can be severely injured and only feel a little bit or no pain early on. Your doctor can easily miss and mistake your pain for something completely different. This is when insurance companies try to settle with you. Don't make the mistake. Until a recognized and reputable doctor who has experience with low-impact soft tissue injuries says you're 100% okay, don't make the decision to settle too soon. Most doctors don't know about hidden injuries that can financially and physically hurt you. You see, after an accident, it's advisable to visit the emergency room to make sure you don't suffer from any life-threatening injuries like broken bones, punctured lung, or internal bleeding. This is what emergency room doctors specialize in. But the problem is that as long as there's no immediate threat to your life, the emergency room physician is likely to send you along your way with pain medication that will mask your pain. And here's the problem with only taking pain medication after your accident. Soft tissues like muscles, ligaments, discs, nerves, and blood vessels need oxygen to function and to move properly. When you only take pain relief and/or anti-inflammatory medication, scar tissue, adhesions can form, limiting the proper motion needed for healthy nerve and blood flow. Scar tissue is also a substandard tissue that can turn into its own source of pain, which can cause a number of chronic pains, symptoms, and syndromes. The problem is that soft tissue injuries are not always visible on x-rays. That is why most doctors don't have the training to detect soft tissue injuries. They over-rely on vital signs, x-rays, and the pain described by the patient at the time. Since many doctors can't detect your injury, they will make the wrong diagnosis about what's wrong with you. So any treatment you get is based on that diagnosis, which practically may do nothing for you. The treatment of choice for medical doctors, like your family doctor, is to use drugs to cover up your symptoms. In your case, the biggest symptom is pain, so you don't feel injured anymore. This form of treatment only gives you the illusion that you're okay, when in fact, you can be seriously injured. So if you're experiencing muscle stiffness, spasms, some sort of neck pain, headaches, numbness and tingling, mid-back pain, low back pain, you may be having a difficult time sleeping, irritable, memory loss, or fatigue, you may be suffering from a hidden or soft tissue injury. Or worse yet, you may be feeling none of these right now because your injury hasn't started producing these symptoms as of yet. Another concern of those that are involved in these accidents is that they're masking their symptoms with pain relievers and over-the-counter medication. Sometimes we don't understand the shocking truth about using pain relievers, physical therapy, and surgery to get rid of our pain. Let's assume that you've experiencing some type of neck pain. How will your doctor attempt to treat you? Well, rather than get you after the cause of the problem, he or she will attempt to cover up your pain with OTCs, or over-the-counter drugs, and other, sometimes more powerful pain relievers. These drugs only work by sabotaging your body's ability to register pain. They do absolutely nothing to fix the problem, causing the pain. So while these drugs are sweeping the dirt under the rug, you're giving the illusion you're actually okay. This is dangerous. Why? Accident victims on pain medication are more likely to settle their cases, and the insurance companies use this to their advantage. Don't make hasty decisions while on pain relief medication. It may come back to haunt you later. While you're on pain relief medication, you are more likely to worsen your injury. Pain is the body's way of telling you something is wrong, or you're making it worse. If you do not feel the pain, you may be aggravating your injury and not even know it. Even a sprained ankle that you've had before, what happens if you're walking on it rather than take a little bit of time and let it heal? It hurts more and more. Why? Because you're making it worse. The same thing is true for these hidden injuries that you may have in your neck, back, and other areas. Yes, you read what I've told you correctly. Your doctor, who means you well, wants you pain-free, may be hurting you by giving you these harmless drugs. That's not to mention the side effects of some of these drugs. Depending upon the drug, you may run into serious kidney, stomach, or liver problems as a result of popping these drugs just to get through a day of work. Once their initial treatments fail, doctors will sometimes refer you to physical therapists. The only problem here is that your doctor tells the physical therapist what to do. This means whatever therapy you are undergoing is designed to treat the problem your doctor thinks you have, when really it may be something totally different. So after this charade, it's no coincidence that most people with these hidden injuries are still in pain and may even feel worse. At this point, you may be sent back to the therapy or therapist for another course of treatment. Odds are it won't work because the person directing the treatment, your doctor, never diagnosed your problem correctly. If you're not sent back to therapy, your doctor may recommend that you see a surgeon about your problem. Surgery is an extremely drastic treatment for those with these types of injuries. If a surgeon doesn't know what to go after, you're probably not going to come out of the operating room fixed. Surgeries, especially in the neck and back, will often only result in a short period of pain relief at best. More than half of all back surgeries will never get you out of complete pain. Plus, there's the added risk of infection, anesthesia problems, not to mention other common side effects like missed time off work and reduced living for weeks or months at a time. Do you really think surgery is even an option you should consider? Especially since your doctor may not even have the whole picture and diagnosed it right. Discover now, if you suffer from a hidden injury, that hidden injuries are extremely serious problems. Unfortunately, medical science is undertrained and unequipped to diagnose and treat them with any measure of success. This is a giant healthcare problem in this country, considering that 20 million Americans have suffered from hidden injuries. The sooner you can find out you have a hidden injury, the sooner you can start treatment plan to eliminate it and to get you out of pain. Wouldn't it be nice to finally be pain-free and living your life the same way you did before the accident ever happened? Wouldn't that be nice? Wouldn't you rather be healthy and alive once again, rather than living the life only one pill away from pain to pain, misery and frustration? Aren't you tired of going to your doctor again and again and never getting any better? You see, your doctor may know there are other treatments out there available to you, but they also know if they tell you that, you may never come back to see them again. You may ask, why should I trust you? We have been in office and practice here for over 17 years, and we're experienced in treating auto accident injuries. Me and my staff are committed to helping you get better fast. We have over 17 years of getting auto accident victims out of pain safely and effectively, without the use of drugs or surgery. I have studied neurology over and above my chiropractic education for years, and I work closely with the author Dr. Michael Johnson of the alternative bestseller, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine, headaches, fibromyalgia, and other chronic conditions. I've spent years fighting for the rights of auto accident victims just like you. In fact, that's why I'm talking to you right now. I'm very tired of car accident victims going through years of pain and misery because no one ever bothered to tell them about their rights and the truth about these types of injuries. I've used my drug and surgery-free methods to help auto accident victims just like you get out of pain as quickly and easily as possible. I've been able to help almost everyone who I've diagnosed with a hidden injury. In fact, I've been so successful and happy with helping people just like you get out of pain, I focused a majority of my practice and skills at getting auto accident victims out of pain and keeping them that way. There's nothing that pleases me more than helping car accident victims just like you. That's why I spend so much time educating people about the dangers of car accidents. That's why I'm offering you a free injury consultation. I want you to know the truth about the car accident pain you may be suffering and why it's there. I know I can help you. What's important now is that you document your injuries. Not doing so may make your injuries worse. They will become more difficult to treat down the road, meaning keeping you in pain longer. And it may also hurt your personal injury case if you decide to pursue legal counsel. Even if you feel okay right now, if you are in an accident, you still run a high risk of suffering from a hidden injury. It's best to play it safe now and get checked out to make sure you really are okay. The slightest injury, even one that you don't feel right now, may lead to a terrible condition down the road that we treat called osteoarthritis. While it is possible to treat it, it takes a long time, and sometimes it is impossible to cure 100%. Worse yet, you may have to foot the bill, and all because someone hit you 20 years before. So call us now at 742-7785 for your free injury evaluation. Your accident has been a big enough hassle already, from getting your car fixed to dealing with your insurance adjuster. That's why we're dedicated to working with you so you can go about living your life on your terms. Whatever you decide to do, remember, you must document your injuries as soon as possible to get the care you may need and the settlement you may deserve. To do that, you need to be checked out by a doctor who is trained and experienced to diagnose and treat the hidden injuries I have talked about. If you weren't alone in the vehicle, the other passengers in the car also have the option to come in for a free injury evaluation. Just give the office a call. We will be happy to schedule a free evaluation for them as well to make sure that everyone is okay. If children were in your car, it is vital that they are evaluated to ensure their bodies are in good working order and are not subjected to unnecessary pain, suffering, or physical problems that they may have later in life. Don't worry, if we do detect an injury, our care is safe and effective for children of all ages. I hope you've benefited from discovering the truth about these hidden car accident injuries. The same truth many people out there don't want you to know. Remember, don't waste any more precious time to get this evaluation. And if you're planning on seeking legal representation, the sooner you document your injuries, the better your case will turn out. Our mission statement in this office is to improve the quality of your life. Call us now, and thanks for taking the time to educate yourself about this very important matter. Thank you.